Jim, is serious medicine about cures?
Serious medicine is based on the idea that it is cheaper and better to beat the disease than to treat the disease. It's better to cure the disease than to care for it. That's just simple common sense economics. It's problem solving. It's the same vision that we apply to most technological problems in our society. We don't finance the old system. We don't still finance rotary phones and with cords. We've moved on to new technologies like smartphones and computers and so on. It's the same principle that seems to have gotten lost when it comes to healthcare policy as defined by the federal government and the elite policymakers in this country.
What needs to change today to make serious medicine possible?
I think we need to look hard at the obstacles to medical progress. I think the FDA is a huge problem. I think that the FDA is basically taking the posture that the downside of releasing a bad drug is infinitely greater than the upside of saving a lot of lives. So the FDA is extremely cautious and risk averse on that score. I think that the trial lawyer environment is completely toxic. If you turn on the TV and all you see are ads for 1-800-BAD-DRUG, as in sue these guys for making it, then the pharmaceutical industry companies and the medical device makers will get the message. There are easier ways to make money in this world than risking the FDA. When you buy a computer, you get a 100-page thing, what they call an end-use license agreement, a EULA. If you see it on anything you ever buy on a computer, usually it's 100 pages of stuff that you just simply click agree, and then it goes away, and that's the end of it. You have no idea what you just agreed to, but among the things you agreed to, if anything goes wrong, with anything associated with your computer, you know, whoever's fault it is, the hardware company, the software company aren't liable. Okay, that's a blanket liability protection that the pharmaceutical industry doesn't exist. We've made a choice, seemingly, that we think computers and software are more important than medicine. I mean, it's a strange choice, maybe, but it's a choice we made. We ought to fix it. In addition, there needs to be real leadership from the political and cultural community so that when we read about, for example, Michael J. Fox or Farrah Fawcett or Patrick Swayze or others who, you know, or the Silicon Valley investor, Michael Moritz, who get sick and potentially die or get sick at least in their cripplingly so, in their 40s and 50s, this is a problem. We need to think in terms of, well, what lessons do we learn about these people who obviously have all the health insurance they need? They have no trouble financing their hospital rooms and going to the best doctors. The point is, in what they call the medical armamentarium of actual medicines, there's nothing there for them for many kinds of cancer and many kind of autoimmune diseases and many kind of neuromuscular diseases. And that's the challenge, is to get in there early and say, look, you know, when Rock Hudson got AIDS, everybody said we have to cure AIDS. When Lou Gehrig got Lou Gehrig's disease, ALS, back 70 plus years ago, there was not a similar effort made on his behalf and all the sufferers since, of whom, you know, quite many, to deal with that. And so that's the challenge, is to then say, how do we create a system where entrepreneurs and investors and scientific visionaries who are currently being told that the real money and the real opportunity and the real upside is in quantitative work for Wall Street or making the next photo sharing social network in Silicon Valley, that the real action or the best action, the most humanitarian, the Nobel Prizes, and the economic rewards are in medicine. There's no discussion like that. You can go through the healthcare policy papers of President Obama or the Republicans in Congress and look around, just do the F2 word search for the search for the words research, medicine, cures. They don't appear. The discussion is, we're going to take care of you, the government's going to take care of you, we're going to empower you as a patient, but there's no real discussion of actual medical cures.
How would you characterize serious medicine as a political winner? Can it be a political winner?
Funny you mention that. A prominent former member of Congress told me once, Jim, you got to understand, healthcare is a loser for whichever party's in charge. That's a quote. And I said, well, you know, I'm sure you're right in terms of the way you're describing the politics of today, that, you know, when the Democrats get in, they push national health insurance, they lose the House. It happened twice, in '94 and in 2010. When Republicans get in, they talk about cutting Medicare, and they get clobbered. I was in the Reagan White House way back in 1981 when we tried this, and 1986 again when it happened, and so in 1995. So both parties have a terrific record of proving that their favored policy nostrums are unpopular with the voters. However, both sides are pushing some degree of rationing and scarcity and cutting because they just don't have the vision to see that if you actually cured these diseases, not only would you be helping people on a humanitarian basis, you could also make reforms like raising the retirement age. And if you cured Alzheimer's, you could then kick the retirement age up from 65 to 70. You'd also be creating spin-offs across your economy in terms of technological development, and also you'd be creating potentially an export drug. The rest of the world is getting the same disease profile that we have in terms of Alzheimer's and other sort of sedentary lifestyle diseases. So we have an export market as well. So it'll be a win, 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 win going for us. Unfortunately, the political class in this town, Democrat and Republican, just doesn't see it that way. So serious medicine is not only a humanitarian effort, it is a job creator, it's a technological stimulus, and it is an enormous potential boon to the American economy. That's why I'm in favor of serious medicine. I think the Washington policy community ought to take a good look at it.